Everything continues to evolve around us, like TVs, automobiles, so does medicine. And really, in terms of total knees, the advancements of doing a total joint replacement and the robotic assisted total knees helps us to be more accurate, has us the ability to put it in a more precise total knee. So I think in terms of medicine and the direction we're going, it's a huge improvement. As we do a total knee, it's not a robot that does the surgery. It is really a software program that allows us to collect more data points. By more data points, then it allows us to be more accurate when we balance a total knee. We have to make sure everything's equal. The more balanced they are, the better they function. As you balance this knee, you get live feedback. So as we're trialing, then the data points we collected to make these cuts, then we can actually assimilate and take the knee with our trial implants to say, did we actually get it right? Does it still map like it's supposed to? And if it doesn't, then we're able to make modifications on the fly without having to start over from the beginning like you'd have to in a traditional knee. I think the biggest advantage in terms of regaining their range of motion, which is the big thing right after a total joint, is their motion gets back a little bit quicker, which is very important with the VELYS and the DuPuySynthes system that we use, that this VELYS is really intended to be used with their implants, which the motion mechanics, the biomechanics of the knee work more effectively, which in turn then creates the better longevity, better function, also helps with a little bit of better recovery. So I think in terms of medicine and the direction we're going, it's a huge improvement. This first case was really, it's a young female in terms of what we think of total joint. She's in her late 50s. Her knee as it stands prior to the surgery, she was bone on bone. It affected her quality of life. As we had this discussion prior to the surgery it's really based on quality of life. And her quality of life was not where she wanted it to be, and so this is the next step. The more we advance, the better medicine gets, the better the outcomes. And that means that potentially, hopefully, patients have less revision surgeries, their implants last longer, and they enjoy their knees and a quality of life. I think by the end of my career, which I still have a long ways to go, every knee at some point will be robotic assisted.